This is your third visit, isn't it?
Yes.
Of Shockwave and Laser. Okay. In your first visit, when I did that, how much pain were you in?
I want to.
You wanted to jump out of
Yes.
the jump out of the chair.
Yeah.
How does it feel now?
It's.
Yeah, you feel no pain now, but it's not quite there because when you do too much activity, then it hurts. You're a chef, aren't you? Yeah. So when she stands for too long, then the pain comes. So today's your third session. Wonderful. We're going to do Shockwave first. All right. I'm going to keep on looking at your face. If I can see anguish and pain, I know I've gone too far. That's good. On the first visit, you only could take 3 bars. That was it. You're up to 5 bars. That's good. I know. You okay? Good. Okay. Alright. I'm going to put it up a bit. Tell me how you feel. That is good. When she started, she only did 2 or 3 bars. Got to 6 bars now, that's pretty good. So we combined the Shockwave treatment with Class 4 laser treatment. This is a Remy Class 4 laser, one of the most powerful lasers in the world. Well, from the USA, invented by a chap called Dr. Zuckerman. And we're going to do Class 4 laser on the plantar fascia. And what normally happens is, if I get my settings right, I'll change it to double touch and increase the laser sound. The patient normally feels a bit of heat when you're having this done. Can you feel any heat at the moment? A little bit. It's normally bearable. Class 4 laser works by healing the actual structures, so it stimulates the chromosomes on the mitochondrial membranes to release ATP, which is an important chemical substance for healing. I find that the combination of Shockwave and Class 4 laser can be very effective for multiple different musculoskeletal conditions such as heel pain, Achilles tendinopathy, peroneal tendinopathy. I'm using it currently for osteoarthritis of the knee, severe osteoarthritis of the knee, and I'm getting really good results with it. So, and generally I'm focusing on the antithesis of the plantar fascia, which is the insertion point, but I'm going through all the bands of the fascia and then into the plantar plate almost, so all the way up, which is where the plantar fascia inserts into distally. And then we're also working the triceps suri, because anybody that knows their biomechanics in the plantar fascia, you know that it originates from further proximal structures. How does that feel?
Sorry?
How does it feel?
It's
Yeah.
good.
It's good.
All good.
Yeah, it's all good.
Yeah.
It's all good in the hood, as I say. So. A trick to this is not to stop in one spot for long at all, because then it will get uncomfortable, because I'm doing 25 watts continuous, 25 watts peak power. We're using 980 and 810 NM frequencies. If you keep it in one location, it will be uncomfortable, which is why you have to keep on moving it. One of the tricks I found, which some of my colleagues might like to do, is dorsiflex the hallux and put the plantar fascia on stress. And then work into the fascia then. And you're really massaging it in with this massage ball. There are some laser units where you just leave the laser on for 10 minutes and just focus it on one area. I have tried those laser units, and I'm not a particular fan of those laser units. I feel that you really need to get into various structures, and the only way to do that is manually do that. What I also found is working the talar crawl joint, increasing the movement can actually help the plantar fascia. Now, there is some evidence to say that class 4 laser can increase the range of motion within a joint, which can help other joints. Now, this patient not only has had extracorporeal shockwave treatment and class 4 laser, she's also had a comprehensive rehabilitation program, which she's been doing every day. Well, she promises me you've been doing it every day, haven't you? Yes. And some semi-custom orthotics, which she's wearing, which have got extra cushioning to offload the fascia. Not really treating the biomechanics as such, but really to offload structures using different densities of poron and EVA.